We are the Association for Child and Adolescent Mental Health, or ACAMH for short.
Hello, welcome to the Papers podcast series for the Association for Child and Adolescent Mental Health, or ACAMH for short. I'm Jo Carlo, a freelance journalist with a specialism in psychology. In this series, we speak to authors of papers published in one of ACAMH's 3 journals. These are the Journal of Child Psychology and Psychiatry, commonly known as JCPP, the Child and Adolescent Mental Health, known as CAMH, and JCPP Advances. Today, I'm interviewing Research Assistant Ahmet Metin of the Department of Guidance and Psychological Counselling at Aegis University Faculty of Education in Kayseri in Turkey, and Research Assistant Eyüp Erbiçer of the Department of Guidance and Psychological Counselling at HCP University Faculty of Education in Ankara. Both are co-authors of the paper Cyberbullying Among Adolescents in Turkey, the Relationship Between Coping Strategies and Cyberbullying Perpetration, recently published in CAMH. This paper will be the focus of today's podcast. If you're a fan of our Papers podcast series, please subscribe on your preferred streaming platform. Let us know how we did with the rating or review, and do share with friends and colleagues. Ahmet and Eyüp, thank you for joining me. Can you each start with an introduction about who you are and what you do?
Of course, Jo. Thanks for your interest. I'm Ahmet, working as a research assistant at Aegis University from Turkey. I like to interest psychological studies, and I will be a PhD coming months.
And Eyüp?
Thank you for your interest. I am Eyüp Erbiçer. I'm research assistant in the Department of Psychological Counseling and Guidance at HCP University. I'm also a PhD candidate at the same department.
Thank you very much. Well, let's turn to your paper. So this is Cyberbullying Among Adolescents in Turkey, the Relationship Between Coping Strategies and Cyberbullying Perpetration, recently published in CAMH. Can you start with an overview? What did you look at and why?
Our study aimed to investigate the relationship between coping strategies and cyberbullying perpetration among adolescents in Turkey. We looked at active, negative, and avoidant coping strategies and examined how these coping strategies related to cyberbullying perpetration. If we understand how cyberbullying perpetrations cope with routine problems, maybe we can help them. So we can work on this issue in future research.
And can you say anything about why it was such an important topic to look at?
In previous studies, usually we focus on the relationship between coping strategies and cyberbullying victimization. But we believe that also focusing on the coping strategies of cyberbullying perpetrators is also so important to develop interventional and preventional programs. And that's one of main motivation. It was one of main motivation to conduct this study.
Can you tell us a little about the methodology used for this study?
Of course, we used a cross-sectional design and involved a sample of 1,020 school-age adolescents from Turkey, and we collected data using self-reporting screening tools, including the cyberbullying scale, which developed by Aricak and his colleagues to measure a school-age adolescent cyberbullying perpetration levels. And also we use coping scale for adolescents, which developed by Spirito and his colleagues to evaluate adolescent coping strategies. And in addition, we run a hierarchical multiple regression to determine the effect of coping strategies and some socio-demographic variables on cyberbullying perpetration behaviors.
Let's turn to the findings. What key findings would you like to share?
Our key findings showed that active coping strategies negatively affect involvement in cyberbullying behaviors. On the other hand, avoidant and negative coping strategies positively affect involvement in cyberbullying behaviors.
In the paper, you identified active, negative, and avoidant coping strategies in your study. Can you tell us a little more about these different coping strategies?
Yeah, actually, individuals who usually use active coping strategies focus on the positive consequences of the stressors which they encounter in their real life. And sometimes they take indirect actions to solve the problem, such as trying to find a solution by getting support from others or seeking help from family or friends or someone they trust. It means, namely, their significant others. And they try to calm themselves, or sometimes they using humor to handle with the stressors. And also individuals who use negative coping strategies, usually they blame themselves and others, or sometimes they express their anger, namely blaming others or self-criticism. But when we focus on individuals who use avoidant coping strategies, generally accepting the situation, they accept the situation or trying to solve the problem alone, or trying to forget the stress by thinking about other things or doing other things. In addition, one of main characteristics of avoidance strategies is wishful thinking. It means that actually we can see individuals who use avoidant coping strategies usually say that I wish it never happened. These characteristics, it can be mentioned when we talk about coping strategies.
Which coping strategies proved protective and which were risk factors? And can you talk through the implications of these?
Our findings suggested that active coping strategies are protective factors against cyberbullying perpetration behaviors, while avoidant and negative coping strategies are risk factors. These findings highlight improving the positive coping strategies of adolescents may lead to less involvement in cyberbullying perpetration. In addition, considering two-way interaction between involvement in cyberbullying behaviors and being cyber victim. If we increase positive coping skills of school-aged adolescents, we may not only reduce the possibility of being involved in cyberbullying perpetration behaviors, but also reduce the possibility of being exposed to cyberbullying victimization.
You mentioned active as being protective and negative as not. What about avoidant coping strategies? Are they also a risk factor?
Basically, the way of withdrawing in the online environment lead to individuals who use avoidant coping strategies, lead to involvement in cyberbullying perpetration behaviors to deal with their real life stressors.
Your paper also looked at socio-demographic variables. Which variables proved to have greatest impact on cyberbullying perpetration behaviors?
Yeah, actually, in our study, we found that the mother's education level was a significant socio-demographic variable related to cyberbullying perpetration behaviors. In other words, involvement in cyberbullying behaviors increases as the mother's education level increases. However, some socio-demographic variables such as gender, family income, and the father's education were not predicting factors of cyberbullying perpetration behaviors.
Can you elaborate on that? I was surprised by that finding. So the finding is that the perpetration behaviors increase if the mother's education level is higher. What do you feel the reason is for that?
Actually, in Turkey, educated mothers are involved in business and other official jobs. And that situation lead to mothers spend less time with their children. And therefore, actually, some studies especially highlighted that mothers spend less time with their children. Because of that, their children spend more time on the internet, like playing games and using social network platforms. And we already know that there is a positive relationship between spending more time on the internet and cyberbullying perpetration behavior. It's a kind of, there is no any caregiver. And we also should have stated that in Turkey, it's a cultural characteristic. Usually, mothers care about their children. Mm-hmm. It's a kind of cultural characteristic of Turkey. This situation led us to explain the finding of our study, actually.
Is there anything else in the paper that you would like to highlight?
Our study showed that using active coping strategy was a protective factor for cyberbullying. More specifically, if we teach adolescents to use strategies for active coping with problems in their routine, perhaps we can minimize their exposure to cyberbullying or its negative impact.
So given what you've said, what are the implications of your findings for CAM professionals?
Our findings suggested that professionals should promote active coping strategies such as seeking social support and problem solving among school-aged adolescents to reduce the risk of cyberbullying perpetration. They should also be aware of the socio-demographic factors that increase the risk of cyberbullying perpetration and target interventions accordingly.
And are there any particular interventions that you believe would increase active coping strategies in young people?
Yeah, actually some prevention and intervention programs such as, coping with anger or developing skills in empathy, social skills and peer support should be developed to improve adolescents' positive coping strategies, especially considering the associations between active coping strategies and some protective and risk factors such as anger, aggression, empathy, self-esteem, social skills, and extroversion. These preventive and interventional programs probably will have a great impact on reducing cyberbullying perpetration behaviors. For example, especially at that point, we should mention that cognitive behavioral intervention effectively increase active coping strategies.
Thank you. Are you planning any follow-up research, or is there anything else in the pipeline that either of you would like to share with us?
Yeah, actually, we already have focused on a follow-up research. We aim to conduct a meta-analysis and systematic review on the associations between risk factors and protective factors related to coping strategies and cyberbullying perpetration and victimization among school-age adolescents in Turkey. But especially I have to mention that. And we base it on this study and the follow-up research. We aim to develop a mobile application for school-age adolescents to fight against cyberbullying.
Thank you both so much. For more details on Ahmet Metet and Eyüp Erbitşer, please visit the ACAM website, www.acam.org, and Twitter at ACAM. ACAM is spelled ACAMH. And don't forget to follow us on your preferred streaming platform. Let us know if you enjoyed the podcast with a rating or review, and do share with friends and colleagues.